authors do not have any financial interest to disclose. Rex's escape is a common complication in a hypermature or intumescent cataract. It lands like an accident upon the operating surgeon. Sometimes there remains no way to continue with phacoemulsification. Conversion to manual small incision cataract surgery may be the only option. To salvage the situation and continuing phacoemulsification without much risk, we thought of modifying a simple instrument. The metallic wire snare is a single-use device made from a thin metallic wire used in manual small incision cataract surgery. The nucleus is strapped inside the wire loop and bisected when the wire ends are withdrawn through the tunnel. We started by disengaging the needle of a 4-0 Prolene suture. The tip of a 20-gauge disposable needle was then made blunt by rubbing on a carbide stone. The two sides close to the tip of the needle were thinned out. 2 holes were made just behind the tip. The two ends of the 4-0 Prolene were now pushed through the side holes to form a loop outside. As the ends came out from the needle hub, they were reintroduced through the tip of another 20-gauge needle. The second needle shaft was pressed at various points to fix the Prolene suture inside. Prolene snare was now complete. Prolene lasso has the unique advantage of retaining its shape even after repeated withdrawals and insertions. The conventional snare, in contrast, loses its shape after a single use. Also, the conventional snare, while introducing, requires an expanded state of the loop of about 4.5 to 5 mm, so it cannot be used through a clear corneal phaco tunnel. Let us now see the practical application of the Prolene snare in 2 live surgeries. Patient number 1 had a post-trabeculectomy hypermature cataract. Clear corneal incision phacoemulsification was mandatory to avoid bleb failure. Trypan blue staining of the anterior capsule was done. Rexis started with an Utrata forceps. But was incomplete because of fibrosis of the capsule. The last part was completed by cutting with a pair of Vannas scissors. The surprise came when we tried to move the nucleus in the bag. It did not budge, as it was encased in a dense fibrous cocoon. Repeated attempts with micro scissors, Vannas scissors, at last enabled us to loosen the hold. By now, Rexis was in tatters, so the nucleus was lifted up in the anterior chamber. Prolene lasso loop was now introduced. The nucleus got bisected easily by it. Though the mobile nucleus was jumping, the loop never loosened its firm grip, just like the lasso, getting tighter while the zebra danced and trotted. The two halves were soft enough to be emulsified in anterior chamber with phacoemulsification. foldable IOL injected through the corneal tunnel completed the surgery successfully. Patient number 2 showed an intumescent hypermature cataract. Rex's escape occurred in the last quadrant. The brown nucleus was maneuvered into the anterior chamber. Gripped in the lasso and snared into 2 equal fragments. Again, the mobility of the nucleus was not an impediment at all. As it was heard, one half was bisected again. These 2 small pieces were emulsified first. The procedure was repeated with the other half. A multi-piece foldable IOL was implanted in the bag. One week post-operatively, we were greeted with a happy patient who had 6/6 corrected vision and almost clear cornea. So, next time when the panic bell rings with a Rex's escape emergency, do not reach for the 911 button. Instead, reach out for the lasso. Thank you for your kind attention.